My name is Alisher, and I'm a recent graduate of New Generational School in Almaty, Kazakhstan. Today, I'd like to talk to you about a pressing issue that affects my country deeply, the healthcare crisis in Kazakhstan, focusing on funding and access challenges. In the past few years, I've had the privilege of earning medals in national and international Olympiads, mentoring robotics team for 5th and 6th graders, and also working on the project with my friends. It's a smart Aid kit that can help diagnose people in rural areas so they can seek for medical attention faster. And my dream is to become a bioengineer by developing an advanced prostheses and artificial cells to replace damaged tissues in humans' body. Now, let's delve into the heart of matter, the causes of the healthcare crisis in Kazakhstan. The healthcare crisis in Kazakhstan stems from several factors: poor diet and pollution, inadequate healthcare infrastructure, shortage of medical personnel, insufficient funding, influence of religious belief, lack of effective programs aimed to improve the healthcare system, and one of the most crucial issues we face is the shortage of physicians in Kazakhstan. The shortage of physicians is a major issue. On average, there are 39 physicians per 10,000 people in cities and only 23 physicians per 10,000 people in rural areas such as villages. Um, the causes of this include insufficient infrastructure, low salaries and poor financial condition, limited opportunities for professional growth, high workload, and isolation and remoteness of rural areas. When we compare Kazakhstan with other countries, the gap becomes even more apparent. Compared to countries like Germany, which has 510 doctors per 100,000 people, Kazakhstan lacks significantly with only 388 doctors per 100,000 people. To address this, Kazakhstan trained over 15,000 doctors and 29,000 mid-level specialists in 2022, offered initiative for rural work, and deployed mobile medical teams. But the shortage of physicians is just one part of the problem. Funding and availability issues are also critical. Key issues here include geographic barriers and transportation challenges, drug shortage and limited availability, lack of medical facilities and personal facilities, underfunded programs and low salaries for medical workers, economic transitions impact, and also inconsistent medical care standards and limited preventative services. This factor all contribute to the healthcare crisis, which also is reflected on our birth rate and life expectancy. Kazakhstan has one of the highest infant mortality rate at 17.9 deaths per thousand live births, with average life expectancy of 72 years. Factors affecting this rates include healthcare quality, living condition, access to medical services, and education. Beyond the structural issues, cultural and religious beliefs play a significant role in shaping healthcare outcomes. Religion and cultural beliefs significantly influence healthcare in Kazakhstan. Gender preference, traditional medical solution, and misconception about doctors' capabilities affect healthcare decisions. For example, some patients might prefer traditional healing methods over modern medical treatment due to their cultural beliefs or religious. Additionally, the influence of religious leaders can shape the community attitudes towards vaccination and preventative care. Addressing these beliefs through culturally sensitive education and community engagement is crucial to improve healthcare outcomes. Moreover, the relationships between people and doctors are affected significantly by various factors which further complements the healthcare landscape. The relationship between people and doctors in Kazakhstan is also affected by various factors. Misconception about doctors' capability and responsibilities can lead to mistrust. Personal and religious beliefs sometimes cause delay in seeking professional medical help within worsen healthcare outcomes. Additionally, misinformation can spread through communities, further eroding trust in healthcare providers. There have been instances where doctors face aggressive reaction from patients' relatives, particularly when delivering bad news, which can harm the moral and safety of medical personnel. Strengthening the doctor and patient relationship through transparency, community, and public education is essential to building trust and improving healthcare system. The challenges are compounded by the management of insufficient diseases like measles and HIV Speaking about measles, Kazakhstan has faced significant challenges in managing infectious diseases such as measles. In 2019, the country experienced a major measles outbreak with over 13,000 cases reported. This situation underscores the need for improvement vaccination programs and better public health strategies to prevent such outbreaks. By enhancing vaccination coverage and public health education, we can reduce the incidence of measles and protect vulnerable population. In addition to measles, Kazakhstan also struggles with tuberculosis, HIV, and AIDS. Um, Kazakhstan is currently struggling with a high multi-drug resistant tuberculosis for shortage MDR-TB. Through the efforts of USAID, the number of tuberculosis cases has been significantly reduced by providing diagnostic machines and supporting the National Tuberculosis Program. Regarding HIV and AIDS, USAID has worked with governments to implement effective data management system and client-focused strategies like index testing and HIV self-testing. These efforts are crucial in managing and reducing the impact of HIV and AIDS in Kazakhstan. Given the extensive challenges, here are some solutions that I propose. Firstly is increasing funding for the medical sector. Secondly, creating organization to educate people about health importance. And also, I like to notice the things that I do currently that I'm doing to help the healthcare system improvements. Firstly, is developing telemedicine service with portable diagnostic devices for remote areas that I talked in the beginning. And also, I volunteered in a local hospital to gain firsthand experience with patients and help doctors with their workload. And for something more people addressed, I've started a club in my high school to bring this the problem of our healthcare system a wider attention. This solution can pave the way for a more robust healthcare system in Kazakhstan. In conclusion, I'd like to say that Kazakhstan healthcare system faces significant gaps in financing and accessibility. Geographical difference, high rates of chronic diseases, and staff shortages, particularly in rural areas, impact the quality of healthcare services. However, by implementing innovative solutions as bioengineering technologies and increasing funding, enhancing public awareness, we can significantly improve the healthcare sector in Kazakhstan and inspire hope for a better future. Thank you for your attention. If you have any questions or would like to discuss this issue further, please feel free to contact me at email provided. Thank you very much. Goodbye.